So a couple of you have asked me about how we actually see a drug interaction between NSAIDs and ACE inhibitors. So just to review, when you give an NSAID, basically what you are doing is you are inhibiting prostaglandins. Prostaglandins are vasodilatory. So when we inhibit those prostaglandins, we're actually going to see a vasoconstriction here at the afferent renal arterial. Okay, so that means that when this gets constricted right here, pressure in this area in the glomerulus is going to go down. So pressure will go down, which means filtration is going to go down. Now, what winds up happening is, just by and of itself, is that as the body, these things called baroreceptors sense that pressure is decreased here, they cause renin to be released, okay, from the juxtaglomerular cells. So renin stimulates the renin-angiotensin-aldosterone system. What that's going to wind up doing is increasing blood pressure through vasoconstriction, and it's also going to increase fluid retention through the stimulation of ADH, or antidiuretic hormone, otherwise known as aldosterone. So that's how NSAIDs play a role in this. Then the question was, well, then how do ACE inhibitors play into all of this? Well, what winds up happening with ACE inhibitors, and the reason that they've been used in people with diabetes for quite some time, is they are typically considered to be renal protective. And they do that by dilating the efferent arterial, okay? So this area is gonna get bigger. This area is gonna get smaller when we're dealing with, so NSAIDs up here, this is gonna get constricted. With ACE inhibitors out here, this is going to get dilated. And what you see is a compounded effect of decreased glomerular pressure in this area. So what winds up happening is you decrease the filtration so much by giving both of those drugs to somebody who already has some renal compromise. You can put them into renal failure, which basically none of this filtration process is working. So we've fallen below kind of that critical minimum of filtration. So remember, NSAIDs constrict the afferent. ACE inhibitors dilate the efferent renal arterial. So blood's coming in, filtering through, and then going out. And what that basically does is compounds the effect of decreased pressure in this filtration area. I hope that helps. Let me know if you have any other questions.